Hi, Dr. Bramlett, Teresa Allen, submitting my PowerPoint presentation. My title of my research paper is Inadequate Treatment for the Mentally Ill Behind Bars. The purpose of this research paper was to examine insufficient care and accessibility to mental health services for the individual once they're incarcerated. This writer used a mixed method of quantitative and qualitative evidence-based studies by undertaking all the literature examination before data was collected. The problem statement, which is a huge problem, appears to be between the two systems, the criminal justice system and the correctional institutions being under pressure and underfunded. There is a major worldwide health concern in which policymakers are strongly encouraging mental health care clinicians to make choices driven by economic concerns rather than treating the needs of the patient. Since deinstitutionalization, 1 in 10 mentally ill prisoners incarcerated are convicted and sentenced into the correctional system instead of being admitted into a state mental health care facility. These individuals have medical comorbidities along with concurring substance abuse issues, which only seem to contribute to the deterioration of their symptoms. Adequate health care is not always accessible, and multiple studies showed that the mentally ill do spend longer time, have longer sentences in prisons. Early intervention is crucial for these individuals because those who go untreated have higher rates of misconduct and they spend exorbitant amounts of time in solitary confinement. The complexity of their mental health system symptoms can often lead to self-injurious behavior and or suicide. There are multiple challenges that exist for the nurses working in this institution, which significantly affects their clinical practice. For example, medical treatment and interventions come last due to the driving nature of security and safety in the institution. Resources are limited and set by administrators, custodial staff, and nurses are often faced with the ethical dilemma of not being able to provide adequate care for the mentally ill. Confidentiality and justice are compromised, which leads to feelings of inadequacy and frustration for the nurse. Nurses need to use evidence-based nursing to enhance the treatment of interventions to improve the care for the mentally ill inmate. Improving outcomes for the mentally ill individuals is underpinned by evidence-based practices. And nurses can use this research evidence to improve practice in the correctional setting. Some examples would be implementing cognitive and behavioral strategies, collaborative treatment planning, of course, individual goals, and teaching individual life skill goals so that the inmate can navigate through the system and be ready and prepared once they are released from prison. And once again, the purpose was to examine insufficient care and accessibility to mental health services for the individual once incarcerated. In my review of literature, a systematic review process was conducted by using multiple databases through Regis College. This writer was able to use primary sources for each article view. A matrix analysis was completed to summarize the mass volume of information. A qualitative and quantitative approach was the most appropriate method to use, as it can be designed to observe and describe a phenomenon. While reviewing the standards of practice and guidelines, some of the related sources were not as current and not as reliable due to data being available only in some states. Systematic reviews were helpful with the overall analysis of the research of this paper. However, information is complicated by the limitations of imprisonment and security in the prison setting. In the review of screening and access to services for individuals with serious mental illness in jails, quantitative graphs represented that 10% of the inmates can wait up to 2 weeks for mental health services. That's for a mental health assessment, that is for medications, and if they have any illness from medical issues. It is also vague if research concerning inmates are being presented to the IRB in an ethical manner. Epidemiological studies were a common theme in prison literature. Some of the methods that they used were interviews, surveys, medical outcomes, case studies. And like I said earlier, the funding for the prisons is limited with financial resources. And with such limited funds, newer research on treatment for the mentally ill that could be explored is not a current priority. It appeared throughout my research that there was no central system of information about the amount and type of literature done involving mentally ill inmates. So 2 of my research questions were, how do we protect those who are suffering and in need of care, and why don't the mentally ill inmates receive adequate care and have the same access to mental health services consistent with all human beings? Evidence-based treatment is the first step to developing the quality of care required for this helpless population. The bigger problem, as mentioned earlier, is between the criminal justice system and the correctional system. They're both under pressure, and the resources are just not available. Throughout the research, there were gaps that persisted where there is further exploration that's needed to investigate more substantial outcomes for these individuals. Data was specific and shows funding and culture impacts the delivery of the treatment. So I think the biggest point to my presentation that I want to be able to express is educated and training in specific crisis programs need to meet the needs for the mentally ill person. Nurses can use research evidence to improve practice. Some education could include, like I mentioned earlier in the PowerPoint, some individual life skills, individual goals. We are leaders, nurses are leaders, and we can advocate and make changes. Providing continuity of care is imperative and is the cornerstone in maintaining homeostasis for this population. We can speak to lawmakers and community-based programs on ways to treat and manage the mentally ill. Mental health clinicians can support and collaborate with state and government agencies. We can collaborate with clinical and families of NAMI, leaders at the state level, to reform this treatment for better healthcare outcomes and accessibility for the mentally ill inmate. It would be extremely imperative to be able to bridge that gap to the revolving door and prevent recidivism for these individuals. Thank you very much. I've also included references to my research paper.